Dementia ambient care, multi-sensing monitoring for intelligent remote management and decision support. Dementia was characterized as a global health epidemic and a public health priority in a 2012 Alzheimer's Disease International report. Alzheimer's disease was first described by Alois Alzheimer in 1906, and billions of dollars have been spent since on large studies to address it. However, no effective medication has been developed to date. People with dementia start to lose their ability to live independently as their condition progresses, which forces them to withdraw from their active role in society and the workforce, and eventually require daily assistance from informal carers like family members. Dem Care aims to mitigate the impacts of dementia by enabling people at early stages of dementia to live at home independently for longer, and by helping carers provide optimally personalised care solutions. To this end, Dem Care has developed a multi-sensor monitoring system where sensing outcomes are fused intelligently for personalised remote care, feedback and support. Dem Care has been designed for 3 environments in 4 countries. 1. Dem Lab is deployed in a hospital lab in Nice, France and Thessaloniki, Greece, to enhance early, accurate diagnosis. In the lab environment, participants visit specialised labs equipped with sensors and monitoring technology in order to objectively assess their ability to independently carry out activities of daily living. Participants perform simple directed activities with the clinician present, monitored by ambient camera and wearable sensors to identify their ability to carry out single and dual tasks like walking and counting. Visual stimuli are used in vocal tasks to trigger participants' speech. Speech analysis algorithms, developed within the Dem Care project, are used to automatically categorize subjects as either healthy, mild cognitive impairment, or Alzheimer's disease, in order to support clinicians in their diagnosis. In order to evaluate a participant's ability to live alone and independently, the system objectively measures their ability to carry out on their own a predetermined set of activities dictated by clinical experts. Ambient camera data is processed by activity recognition algorithms to automatically detect the activities the person is carrying out, their duration and possible repetitions. All these contribute to a more complete and objective participant profile. In different environments, emergencies can also be detected, immediately notifying carers. Motion sensors are attached to objects of interest, that is, teacup, kettle, drug box, to indicate which objects are used and provide details about which activities are being carried out and how. Smart plug sensors are attached to electric appliances, for example, the tea kettle, radio, TV, to collect power consumption data for activity detection. This is an indicator that such activities can also be performed successfully or not in everyday life. While activities are captured, data are fused and analysed in order to detect missed, unsuccessful or successful activities, contributing again to the participant's profile. The automated analysis of the sensor data resulted in the clinical assessment of healthy, mild cognitive impairment and Alzheimer's disease participants, with 83% accuracy, making a significant contribution to Alzheimer's disease community. 2. Dem Nursing Home is monitoring daily life in a nursing home in Luleå, Sweden for increased safety and lifestyle feedback. 3. Dem at Home is deployed in homes of people with dementia living alone in Dublin, Ireland and Thessaloniki, Greece. In the home environment, Participants' homes are equipped with sensors and monitoring technology in order to objectively assess their ability to independently carry out activities of daily living and to support them through specific interventions in order to improve functional and cognitive skill and their quality of life in general. The project involves various types of sensors, such as sleep sensors, to provide useful information about the duration and quality of participants' sleep. Systems and clinicians' interventions focus on the improvement of the sleep routine, which can enhance many cognitive skills such as attention, orientation, and prospective memory. Presence sensors are used to capture the participants' duration and number of visits in specific rooms in their homes, for example, the bathroom. Wearable activity sensors are used to measure participants' activity levels during the day. Based on each person's individual profile and habits, the clinician decides the number and type of activities to be monitored. Even information on activities such as plant watering can provide useful information to clinicians in order to create personalised patterns for activities of daily living. Installation and monitored activities are selected after repeated interviews with the clinician. The clinicians are able to see remotely, for example from their offices, the results from ambient and wearable monitoring sensors, which are fused intelligently through relevant interfaces. These fused outcomes of the sensor measurements will support diagnosis, the selection of treatment interventions, the monitoring of their compliance, and the evaluation of their effectiveness in improving the participants' quality of life. Through specific interfaces that are available for mobile and desktop use, the person with dementia is able to monitor measurements such as daily activity or sleep routine. Based on the intelligently fused measurements, the system provides automatically personalised guidelines or advice to support any problem or issue. During the Dem Care home pilots, clinicians are visiting the participants regularly in order to evaluate their progress or attitude. Each new wearable sensor is introduced to the person with dementia by the clinician. For example, in Dem Care, a wearable camera is used to detect and analyse various daily activities. The clinicians are able, via a mobile device, to remotely monitor sensor analysis results from data that had been captured minutes ago in order to compare them with the participants' attitude and feeling. Based on these results and face-to-face assessment, clinicians can suggest interventions such as relaxation exercises. Dem Care provides a different aspect on how we can clinically assess a person with dementia's functional, emotional and cognitive problems by helping people to face their problems and apply specific interventions to improve their life. Extended home pilots have shown that the Dem Care improves the participants' sleep quality and daily routine in general. Dem Care contributes to a secure environment and enhances feeling of security for both people with dementia and their families, delaying hospitalisation and reducing the need for carers' support. The full range of Dem Care's possibilities is thus being demonstrated in a variety of real-world situations where it is enhancing the clinical picture of the people with dementia, providing timely, relevant feedback and overall improved care, while at the same time increasing their sense of safety, security and independence.